Hi everyone, it's Kelly here again, and this is a little off topic of what I normally do with my crafting videos. But in my last video with my Christmas village, I had said that I wanted to make this video with my husband's journey when he was going through bladder cancer and how it turned into so many different things. So I just wanted to maybe put this out there to help somebody and especially to help them know that they can ask questions if they feel like something isn't right. So let me get into it because it's going to be a long story. My husband, back in, now I'm going to be looking down because I've got a whole bunch of notes. Back in the fall of 2022, my husband started having symptoms. He was having some blood in his urine, some pain in his pelvic area. But he kept saying he just thought it was maybe a kidney stone, kidney infection, and he kept putting off going to the doctor. And I kept trying to encourage him, please, have this checked out just to make sure. My husband has a history of testicular cancer, and so I just want to make sure that if it's anything, we need to get ahead of it. So at that time, he had made an appointment with his urologist, but he couldn't get in to see him until March of 2023. And so he thought he could just deal with it until then. I had just started a job in January of 2023 as a home health nurse. That's what I'm registered as a nurse. Jeff had retired from his longtime job as a project manager at a company, but then he kind of got restless at home, so he started this little manufacturing position to where he could just, go to work, do his job, and come home, and he didn't have all those responsibilities, and he was enjoying it. In February, it was February 9th. I was at work. I was actually in training with another nurse, and he called me and he said he was having some really bad pain. So I told him to go to the local ER and that I would meet him there. So I left work and on my way home or to the hospital, he called and told me that they had done a CT and found kind of a mass in his bladder. And so they were sending him straight over to his urologist. So I told him, I'll just meet you there. So we get there, and his urologist said that on the CT they had found a mass, and they weren't quite sure what it was, but it was really suspicious. So they told him that they wanted to refer him to a doctor down in Nashville. So from there, we went home and we went back on to meet with this new doctor in Nashville. He was a great doctor. And he had a scope done, and they had seen the mass, that it is quite large, and they wanted to go in and remove some of the mass and send it to pathology to see what was going on with it. And so on the 14th, he went in, and they said it would take about an hour and to get a piece of this mass. And I got really nervous because it was like 3 hours later, they finally told me, he was out. And what they had done is they had tried to scrape out most of the mass. So that was good, but it made me really nervous for them being in there so long without telling me what was going on. So on February 28th of that year, they came back, and they said, the doctor said, we feel like we need to remove the whole bladder so they can kind of contain the whole mass and just remove it. And that would end him up with a urostomy, which means that the urine is coming out. They redirect the path of the urine out through a tube that comes out his stomach, and it drains into a bag. So on February 28th, like I said, we went back to Nashville. They removed his bladder and his prostate, his partial urethra, and some lymph nodes. And he ended up with that urostomy, which he did great with. He took it well. He, took care of it very well. So I was really proud of him for taking that, taking in that so much, taking that in, because it was a big deal. On March 21st, the doctor had gotten the pathology report back and said that he had found some cancer cells in his lymph nodes in his pelvic area. And so he wanted to refer him to a cancer specialist to get some treatment for that, just to get ahead of it. And so he referred us to this wonderful doctor. He worked in cancer research at Sarah Cannon Center. And he was really a wonderful doctor. We had a lot of great doctors. So on March 27th, they sent him to another hospital that was closer to us to have a port placed for chemo treatments. Like I said, I've got a lot of notes here, so bear with me, please. Okay, so after that, we had a follow-up appointment with the surgeon who removed his bladder, and he said that everything was doing well, and he was just getting progress on, where we were with the cancer treatments. On April 11th, that was our first appointment with the cancer specialist, and like I said, he was in research, so we felt like he would be in all the know of the good treatments and things like that. So he just talked to us, and we decided on chemo with 4 cycles of 2 weeks on and 1 week off. And so on April 18th, we arrived at Centennial Hospital to receive his first chemo treatment. And so we got there at 8, and it wasn't completed until about 3-4 o'clock that afternoon. The doctor, cancer doctor, he came over and he looked at his labs at that point, my husband's labs, and said that his potassium was really high. And before we went home, he wanted us to go over to the emergency room and for them to, try to get that level down before we went home. So we went over to the emergency room, and they gave my husband Keppra, which what that does is it attaches to potassium, and then it'll come out through his bowel movements. So we went over there, and he had that and a breathing treatment because he said he was having kind of a hard time breathing. And all of a sudden, he went into like not cardiac arrest, but his heart rate was like 150, 160. He was having horrible chest pain, breathing. He was having a hard time breathing. He was having this horrible pain in his shoulder. And so he had me just like gripping his shoulder just to try to get some relief from that. And they brought down the crush cart, and it was awful. So he was admitted to the ICU with blockages, kidney failure, 3 septic infections, and uncontrolled blood sugar. And this was, I found out later when I talked to the doctor, I said, why did all this happen? And he thinks that all those things were kind of underlying, and the chemo just made it just kind of all blow up. So it was a huge mess. And so on the 19th, the next day, he was moved to the cardiac floor just because of those blockages. Of course, they weren't going to be able to do anything about those blockages because he was in such poor shape. Excuse me. So he was in Centennial for 3 weeks, and while he was there, he began dialysis, and they were having problems with that because he was getting a reaction to the filter. His lab values had started showed that he was retaining fluid, and he had an abdominal CT, and that also was affecting his kidneys. The contrast will affect your kidneys. So I hope that this helps you, to, like I said, ask those questions, since 2 days before it was showing his kidneys were failing. So just really, ask these questions, like, is that going to be with contrast because his kidneys are failing. During his hospital stay, which was horrible, one night they had placed a central line, which they inserted in through the neck and run these tubes or wires kind of like down into his heart, and he would like receive medication and things like that through that central line. Now, this is a sterile procedure, so it's very serious because like I said, it's leading to the heart. And so one night he was having some cardiac issues, and this was, I can't remember what night it was, like the next couple of nights or something. He started having cardiac issues, like I said, and that dressing over that central line was falling off, and I was so upset about it because I couldn't get them to cover that needs to stay very sterile. And he was coughing and people were all up in his face, and I was just very upset about that. He also became that night it really worried me because mentally he just like regressed into like almost a childlike state. And I was so upset about that. But luckily, the next morning when he woke up, he was back to himself. So thank goodness for that. So like I said, we were in there for 3 weeks. And on May 5th of 2023, he came home from Centennial, and he started dialysis at a center, and he went there 3 times a week, and he did that for like 3 months, and he handled that so well. I think other people being there in the same situation, he kind of found a support group almost, just from those other people being in the same situation. So he did that for about 3 months, and during that time, he did really good. In July, he went to see his primary, caregiver or primary doctor, and she was trying to help regulate his blood sugar because it got out of control and everything. So she was regulating that. And during this whole time, she was being notified of Jeff's situations, health, during this time. So that was good that she got put in the loop of everything. So we did that. And then, let's see, on July 27th, that night after his dialysis, Jeff did not feel good. And so we called the doctor and reported this to the doctor. The next day he went to a diagnostic imaging for vein mapping, because they were going to place a arterial venous fistula for dialysis, which he was getting dialysis where they would have to put a needle in and do it that way, but they were going to put in the fistula. It's more of a permanent type of thing while he was getting his dialysis. We went on July 4th. We went and had an appointment with a heart, lung, and vascular surgeon, and just to kind of get him in on Jeff's health journey. So he was a really good doctor. He went and had, on the 11th, August 11th, he had a ultrasound of his kidneys, and we were going to talk to the doctor that did his bladder removal about the results of that. Let's see. We went back to see that heart, lung, vascular surgeon again on the 14th, and we talked to him, and he really is like, we really can't do anything because you're still having a lot of issues. You're not stable enough to go in to have those blockages or put stents in. So he was just going to kind of just keep an eye on Jeff. Let's see. On August 25th, we took Jeff to the hospital down in Nashville. He was going to have a kidney stent placed because it wasn't draining. The left kidney wasn't draining really well. So when they took him into surgery to do this, they found that they weren't able to place that stent because his kidney was so swelled up that they couldn't get it in there. And so what they ended up doing is they ended up putting a tube in his left kidney, and it drained into another drain bag out his left side of his back. So we would just, keep draining that bag, so he could get, that kidney would keep working. And they assumed that they'd eventually be able to take that out. So here he is with two, drain bags, one on the right side of the abdomen and then one on his lower back side. On September 2nd, we went to the emergency room, a local emergency room, because he didn't feel good, and his blood sugar was 499, which is super high. His vital signs were his blood pressure was 63/40. His heart rate was 109 to 140, and his temperature was 102. At that time, he was sent by ambulance to the St. Thomas Hospital in Nashville. He was admitted there with sepsis of both kidneys, and they started IV antibiotics. Okay, so he was there until the 6th, and he was discharged with antibiotics that he would be taken by mouth. On the 8th of September, we went to Tennessee Oncology and talked to that specialist, the cancer specialist, and we decided that, well, actually that appointment was canceled because we were going to just meet with him after we had a PET scan. They also canceled the fistula, for the dialysis because he was having less dialysis at that time. He was getting better, so they thought he was going to eventually be able to get off of the dialysis, which he did. On September 18th, we went and had a PET scan that was ordered by the surgeon that removed his bladder. After the PET scan, we talked to the surgeon, and he was telling us that there was some bad news on that PET scan. So the next day we went and saw the cancer specialist, and the PET scan was showing a large mass and multiple cells in his pelvic area and his large colon. And so we talked about treatment plans. We knew he couldn't have chemotherapy, so we were talking about immunotherapy. On October 6th, he had a echocardiogram with the heart doctor, and we didn't get the results of that day. On October 12th, we went in and had a CT and MRI. So we're still waiting on all these results. On Friday the 13th of 2023, we went to the cancer specialist to talk about, treatment plans. And with the PET scan, luckily it showed no cancer was found in the brain, but there was still that mass in the pelvic area. And so we talked about immunotherapy, 36 minutes every 3 weeks, which immunotherapy is good, but it's a lot less aggressive. But at this point, we're kind of just talking about keeping the mass from growing and hopefully shrinking it some, but not really getting rid of it. So, kind of prolonging his life. So on October 16th, went to the doctor in Nashville, and they removed the dialysis port that he had. He had one in his chest. Let's see. On October 18th, we went to a kidney specialist, and he told us that my husband's hematocrit was at 8. His creatinine was at 3. And so he was going to order labs monthly, and we were talking about doing a transfusion because of his hemocrite. His hemocrite, normally for a man, his age should be 41 to about 50, in that range, and his was 8. So he was low on red blood cells. On October 25th, we went and saw the bladder cancer doctor, the one that took out his bladder. And we were telling him about my husband having, fevers kind of off and on. We talked to him about a protrusion in his stomach and realized that now he's got a hernia. But we decided we were not going to worry about that just right now. We're going to, worry about the more major issues going on. And he talked to him about getting him some testosterone treatments. Of course, my husband said, no, let's just worry about what we have right now going on and then figure that out later. So he's having so many things going on at one time. It was just pitiful. So we went on November 3rd to Tennessee Oncology, and he had his first immunotherapy treatment plan, and that lasted like 36 minutes. So, and he had no issues with that, no problem. So thank goodness for that. He went to our local hospital on November 15th for a red blood cell treatment because, of course, like I said, his hemoglobin was 7.9, and it should be normal range 12 to 15 for a man of his age. I told you there was so much going on all the time. I was so thankful that I was not working at this time, so I was able to be with him and take care of him. On November 21st, we went back to Tennessee Oncology, and they did some labs on him, and we talked to the cancer specialist. The doctor said that he wanted to order a ultrasound of his right leg. Now we've got something else going on, because one leg was so much bigger than the other. It was huge. It was like double the size. And so let's see, when did we do that? So we were scheduling all that to get that done. On November 28th, we went to his primary doctor, and we got a prescription, because his blood sugar is still uncontrolled. And so we're back on, more insulin and things like that. He went back on the 29th to get his second red blood cell treatment. His hemoglobin was 8.1 at that time. On the 30th, we went to another local hospital and had an ultrasound of the right leg, and a blood clot was found. So he was started on Eliquis, which is a blood thinner. December 12th, we followed up with the cancer specialist, and he did the labs, and we just, it was just kind of a check-in type of thing. On the next day, on the 13th of November, we called the bladder cancer doctor and talked to his office, and they told us to come down to the ER because his nephrostomy, out of the left side of his back, he wasn't getting any output So we were worried about that. So he told us to come to the ER. So we got there. He was admitted. He went into ICU. His blood pressure was running low again, like 80/50. So he was in there. Let's see. We had to cancel his cancer doctor appointments that was supposed to be on the 15th because, you know, of course, he was in the hospital. On the 18th, I think it was the 18th of December, so they told him he had to start getting back on dialysis because his kidneys levels were back down, and it was just really disappointing because we'd come so far with that. So on December, I can't remember if it was on the 18th or the 22nd. I think it was the 18th. We talked to the hospital internalist, and she came in and she had the worst talk with us. She told us, or my husband and I, that at this point, my husband had to make a decision. He could go home on hospice and pass away, you know, stop his dialysis and pass away from kidney failure, which is painless. You know, you pretty much just kind of go to sleep. But without dialysis, he'd only last probably about 2-3 weeks. If he decided to stay on dialysis, he'd probably live like another 8 or 9 months. But then, because the cancer was growing so fast, that he would pass away from cancer at that time, and that would be more of a painful death. So he had to decide about what he wanted to do. So he decided he was going to just go home without dialysis. And so he signed a DNR, do not resuscitate. And and they gave him a bunch of dialysis, just really to kind of prolong what he could. And so on December 22nd, sorry about that. On December 22nd, we went home, and the next day a hospice came out and talked to us, and clergy came out. And so I told them, hospice, that I would take care of my husband. And so they provided us, they were wonderful. They provided us with his medications, you know, like they gave us some like pain medicine and some medicine for, now when you are going to pass away from, when your kidneys are failing, you just feel like bugs are crawling all over you, because that those toxins that you normally, you know, pee out is just in your body, and it's just going to make your skin feel itchy. So they gave us some medicine for that. And we ordered a hospital bed in our family room, and then, you know, our kids, you know, stayed with us quite a bit, and his mom and dad lived in an apartment downstairs in our house, and so they were here too, so that was good. And so we just took care of him and visited with them. And we could tell, like, his mind was kind of deteriorating, but we just wanted him to be as comfortable as possible. So we just took care of him. And then he passed away on January 9th of 2024. But I'm not going to stand here much longer, but I just wanted to tell you that you need to ask questions, and if something doesn't seem right, you need to ask why and make sure that this is what should be, done, and if everything's being done to prevent other things from happening. But if you have any questions, just leave them down in the comments. I'll try to, help you with anything I can. But thank you for listening. And like I said, I hope this helps somebody. I looked online at this time to try to find somebody that was kind of going through some things like I was. And there wasn't really anything on YouTube books or anything like that, or in the internet, kind of like what I was going through, because ours was kind of unusual because my husband had that reaction to the chemo, and that's actually what he passed away from, was a complication from getting chemotherapy. So I just wanted to put that out there, and just remember to ask questions. Don't feel bad about it. And just, kind of go with your gut and your instincts, and to give, so your loved one has the best care. Thank you again for watching, and I will see you soon with some crafting videos. Take care, everyone.